In 1971, Dr. Thomas Graham moved to Nashville to practice pediatric cardiology. Since then, he has not only treated, but truly touched the hearts of countless children, changing many of their lives forever.
You know, I love working with children, and I love working with young people. It's wonderful to see the results of not my work, but our team's work for taking care of children with very complicated disease and seeing, in most cases, a wonderful outcome.
Dr. Graham is a member of the Board of Trust of the American College of Cardiology. He has chaired the American Heart Association's Council on Cardiovascular Disease in the Young, and he's been listed in the best doctors in America. But his most impressive credentials are the lives of his patients, like Lee Flatt.
Lee had an unusual blockage of his aorta, and it was always in the sort of moderate range, and the question was, since we were following him from a very early age, when would be the optimal time to operate?
Lee's surgery took place in the summer of 2003 and was a great success.
They actually took my aorta, put a slit in it, and widened it, and then put a patch on it to keep the flow going. I feel a lot better all the time. I breathe easier, I can run faster, longer. Just regular things are getting so easy for me now.
Cyan Scarpati had to have 3 surgeries in her first 2 years of life and numerous surgeries and interventions since then to correct a complicated congenital heart defect. But even in difficult and uncertain times, Dr. Graham has been a comfort to Cyan and her mother, Rebecca.
He was just so full of goodness and so full of hope and such a caring and nurturing doctor for us that I think it was the first time that we really had, great faith and hope that, things are going to be okay. We're going to get through this, and we're going to get through this.
He's really nice. He's really great.
Dr. Graham has told us sometimes that she is really the litmus, that they say, how is Cyan doing? Well, this is how well these kids can do then, because she just has done so well overall.
Dr. Graham's natural ability to care for his patients on a physical, emotional, and social level is so important because he helps his young patients live well and embrace life with their heart conditions.
He kept me out of sports, and that helped me find what I really wanted to do. I play a tenor saxophone, and I'm in a marching band now, and that's become a lot easier since surgery. And I'm in chorus. I do a lot of singing.
I like singing and dancing, and I like acting and stuff.
Families face incredible challenges when they learn that their child has a congenital cardiac defect. It makes me feel good when we're able to treat not only the physical but the emotional needs of the patients and the families.
For over 30 years, Dr. Thomas Graham has established bonds with his patients that stand the test of time, and he's helped make their hearts strong enough to stand the test of time as well.
Whenever we went there, it seemed so easy to talk to him, and my whole family thought it was too. I mean, we've just known him since I was born, so he just kind of assimilated into the family.
He's just been a wonderful extension of our family, as well as an incredible doctor for Cyan and someone who has helped keep our hearts up and going as well as Cyan's.
He's nice, and that you don't have to worry, because if you are scared that you shouldn't be, because he's really nice. And when you go in and you're finished, you'll feel really good, that you know that you are lucky to be alive.